Right. Many times cases of peripheral arterial disease or PAD go untreated because of lack of knowledge by either the physician, the patient, or both. In our training historically, we're told, well, if the foot starts to turn black, then send it to the surgeon, because patients who have peripheral arterial disease are at much higher risk for complications from surgical procedures. It's because of the associated heart disease, etc. However, what we can do nowadays is we can assess all this blockage at the same time. So we know that we can, in teaching the primary care physicians about the blockage, they can be much more adept at diagnosing it. Since we have much easier treatments, they can feel much better about referring it earlier for treatment so to keep the patients functioning. And also the patients. As we get to be a more senior population, we know that even just being over the age of 65 to 70 is an independent risk factor like cholesterol or high blood pressure for the development of leg blockage or blood vessel blockage. So that we know that the patients and the public as a whole need to be more aware of this disease process. If you look at peripheral arterial disease, the chance of dying from a blockage in your blood vessels is extremely high. If you look at the 5-year chance of being alive, or worse, being dead, it's similar to almost lung cancer. It's a better prognosis. If you have patients who have breast cancer live longer, patients who have colon cancer oftentimes live longer. So this is a very aggressive process. Even if you just have cramping in your legs, where you walk and you get tightness in your calf or your leg gets heavy, we know that if no other diagnosis is already made, that patient has a 30% chance of dying in 5 years. The stents kind of look like those curlers with the bristles in them. If you take the bristles out, that's what a stent is, and it acts like scaffolding in a mine shaft. And stents have actually revolutionized the treatment of blood vessel blockage. And the reason being is we can, without very large incisions, I mean, we're talking an 1/8 or 1/4 of an inch, insert these little devices that come wrapped around balloons, put them inside the blockage, expand it open to keep the blockage pushed outside. Then the stent actually gets incorporated into the blood vessel and maintains that opening. What stents allow us to do is to actually treat blockage without major surgery, and with so far very acceptable recurrent blockage rates so that the patient can be treated. The nice thing is it also allows us to treat it multiple times if need be, because these stents are very thin, and if scar tissue would form, we can put another one in to keep the patient functioning. With a lack of large incisions and no general anesthesia, really just local anesthesia like a dentist uses most of the time, patients can be treated and get back very quickly to their regular quality of life, except that now they're able to walk or do whatever they need to from the blockage that we took care of. At other hospitals, vascular programs are usually run by just one specialty. They have what we call wound care centers. But the reality of it is that wound care center, over 60 to 65% of those patients will usually be bed sores, and they don't have anything to do with blood vessel blockage. We know that there's an epidemic of vascular disease occurring in the United States because there's an epidemic of diabetes, and we're also getting older as a nation. We know that the best way to take care of these patients is to be very focused on their disease process, and not just one specialty, but everybody coming together as a group to taking care of that patient to make sure that they get very quick diagnosis, testing, and treatment for that disease process, and to get them back as a productive member of society and back to their normal set of life. Well, at Riverside Hospital, we've been treating heart disease for a long time, very aggressively, and we've got very adept at that. But we noticed that even about 10 years ago, that the patients that had peripheral arterial disease or blockage elsewhere just weren't doing so well because of the large surgeries that were really required. So we actually started 10 years ago transferring much of the technology that was available in hearts to the lower extremities. And in that over 10-year experience of being able to do this, we've helped develop some of the new procedures that are done throughout the world to help patients to get their blood vessels opened up. This allows us to have very high success rates at Riverside, higher than I think most institutions around. And the reason is that we have experience. We have experience of doing this over a decade with very high success rates. when companies are looking at new technology, because we see so many patients, they actually ask us to look at their technology very early on, so we can actually run Europe now head to head, where Europe was ahead of us for a long time with getting new technology. So we're very excited about our success rates at Riverside.